Hello everyone. Today our group is going to be presenting our research topic, ultrasound therapy for Alzheimer's disease.
Good morning, everyone. As of 2024, over 420,000 Australians are living with dementia, with Alzheimer's disease being the most common form. While it primarily affects older adults over the age of 65, early onset cases can appear as early as the 30s or 40s, showing that this condition can impact people much earlier than expected. Alzheimer's is a progressive neurodegenerative disorder that leads to the decline of memory, reasoning, and daily functioning. This occurs due to the buildup of amyloid beta plaques and tau protein tangles, which interfere with communication between neurons and eventually cause cell death. In recent years, researchers have started exploring ultrasound therapy as a potential treatment option. While it's still in the early stages, this approach has shown promising results in improving brain function and targeting the underlying causes of the disease. In this presentation, we'll explore how this innovative technique works and its potential role in the future management of Alzheimer's disease.
Now we're going to look at how this treatment works. First, microbubbles filled with inert gas are injected intravenously. These microbubbles are approved by the FDA as ultrasound contrast agents. Next, an ultrasound transducer, often integrated with an MRI scanner, is used to focus low-intensity ultrasound waves precisely on the brain regions affected by the Alzheimer's pathology. When the focused sound waves encounter the microbubbles, these cause the microbubbles to expand and contract in a rhythm. This stable oscillation gently pushes and pulls on the cells of the blood-brain barrier, temporarily loosening the tight junctions between them. This creates a reversible opening that lasts for several hours. With the blood-brain barrier open, it allows therapeutic agents to enter the brain and directly target the plaque. Cost is an important factor in every treatment. Traditional antibody therapy can cost around $25,000 to $100,000 per patient per year. As Alzheimer's progresses over time, the patient would require multiple sessions, which will add to the costs. Final cost depends on the number of sessions required, geographical location, and negotiations with the health care providers. This treatment is still in trial phase, which is why the costs have not been determined by the providers yet.
Ultrasound therapy faces challenges and limitations in terms of precision, safety, and result consistency. Focused ultrasound requires a high degree of precision. The blood-brain barrier is only a temporary opening, so any treatment must be completed within a few hours. Using MRI guidance increases precision, however, even small movements can be problematic for targeting the correct region. There are risks with the repetitive opening of the BBB using ultrasound, with risks of cerebral hemorrhage or edema, but this can be reduced with careful monitoring. Short-term neurological effects of opening show limited safety risks, however, long-term effects still require further research and clinical trials. The effectiveness of the results varies due to skull thickness and shape, which affect ultrasound waves from patient to patient. The consistency of results varies between animal and human studies. Animals show improvement in amyloid clearance, however, due to the limited human data, results are mixed.
In the early stages of preclinical and clinical trials, but in the 2018, the Wu et al., the whole procedure was done using focused ultrasound and real-time mapping, and they achieved an accuracy of around 2 millimeters, safely opening the blood-brain barrier in both cortical regions without surgery. This resulted in no tissue damage and proved its non-invasive and efficient nature compared to prior Alzheimer's treatment plans. This has further been developed in the Karascani et al. Study, which had positive results, which they used the focused ultrasound to open the blood-brain barrier to introduce therapeutic agents. Using the Morris water maze, Alzheimer mice treated with focused ultrasound had high capacity to remembering the targeted area at 43.2% versus 37.7% from non-treated mice, showing significant spatial memory improvement after the treatment. This translated to the clinical trials results, where 4 out of 6 patients had a success in the treatment during clinical trials in Ye et al. 2025 study. Amyloid PET scans showed decreased amyloid beta burden in 4 patients, but increases in 2, indicating variable response but approximately 70% success.
Now, for future advancements, we need to look at low-intensity focused ultrasound therapy instead of high-intensity to find out that breakpoint where we can reach the same results as high-intensity but with less adverse side effects. We also need to look at how we can enhance our diagnostic techniques such as liquid biopsies for early detection of Alzheimer's and to monitor a current treatment of therapy. Last but not least, we need to look at our transition between the use of therapeutic drugs to antibodies so that we can increase its efficacy and lessen its side effects currently. Now, currently, the accessibility to this therapy treatment is not available for the public, but it is available in clinical trials. And should you want to be involved in these clinical trials, current and future ones within this year or next year are going to be held within United States, France, and in China, with their clinical trial numbers within the slide. Thank you.